Thank you, everyone, for being here, and I'm sure you're having a great time talking to each other. But we have 4 wonderful panelists for our second panel today, which is called Actionable Insights to Drive Social Innovation. But really, it's about what we've been talking about. It's about collaborations, it's about alliances, it's about how partnerships can help scale the work of the innovators. And so we have some great examples up here. I'll just briefly name our panelists. We have Katya from the World Economic Forum. We have Tapiwa from Impact Hub. We have Katusha from the Bertha Center. And we have Abimbola from My Medicine. And again, from all over the world, Geneva, Zimbabwe, Cape Town, and
Nigeria.
It's amazing. So very happy to have them here, and maybe we can welcome them. So perhaps I could begin with you, Katya, the World Economic Forum, because you're running an alliance of alliances, and or like a higher level alliance. And I'm curious how your alliance is helping some of the social innovators scale their work, partner.
Yeah. Thank you so much. I can hear my echo. Is it? Anyway, and it's, I mean, it's challenging to speak after lunch, especially.
Exactly.
But it is a little, and it's also very humble. I'm very humbling to actually speak after the first part of the day and after all the panels, which were really inspiring. So the only thing that's kind of comforting me in my nervousness right now is that lunch a little bit put us all together, and now we know each other, so I can be a little bit relaxed on that. But yeah, as you told, so I'm leading the Global Alliance for Social Entrepreneurship. I know it's like very long name. It's like World Economic Forum, Global Alliance for Social Entrepreneurship, and we actually just launched about a month ago during the annual meeting in Davos. So what is the alliance about? It is an alliance of ecosystem actors who support social entrepreneurs. So we are not directly encompasses any social entrepreneurs ourselves. We rely on the community of the Schwab Foundation social entrepreneurs. So many of you can know about that community. It's like about 400 awardees, very established social entrepreneurs. And for example, like a PASS organization who've been earlier here today is, I believe, one of our awardees. So we have this community, we have fostered this community for 20 years. And what we realize is that, of course, to make this community flourish, we need to rely on collaborative action. And we are, again, when we are saying we, it's like World Economic Forum. So that kind of comes in our mission as well, to bring in partners together. So during the COVID, kind of on the urgency of the COVID, we also brought together the key actors, key ecosystem actors, or enablers, how we call them, that can support social entrepreneurs. And during the COVID, it was more focused on the relief, of course, and support and mobilizing the relief, but also giving the visibility to what social entrepreneurs accomplished even during the COVID. I could tell even by statistic, when everything fails, when all the system fails, social entrepreneurs are the one who actually flourish. Through the COVID, the research shows that even on the turnover of the social entrepreneurs at large globally actually increased. So we wanted to give the visibility to them as well. So that's what's during the COVID. And now what we realize as well is that, again, we all base our advancement or scale on the collaboration. Mm-hmm. And that's, we're very well placed to continue fostering this collaboration. That's why we launched the alliance as a global alliance for the social entrepreneurs. And I know that I'm kind of running long, to pick up like 3 things that I've heard from the previous panelists and from the minister on the opening. And we are, again, very humbly trying to base actually our work on these 3 things. And the first thing is that, again, partnership can unlock the world. Absolutely believe in that. That's in the mission of the forum, of partnership and improving the world through the partnership. And I'm saying through that, I know that I'm the only one sitting there who is from Geneva. And I understand that, like from the global north, we're in the really nice village with a very nice view and the office, and as well recognizing that Are we? Yeah, recorded. Okay, very carefully. Recognizing that. I mean, we're not. It's not Chatham House rules.
I don't think it's public.
Okay, so like let's so the Davos is very special gathering, and we know that, and we bring in a very special people together. But I could tell you the thing is like while 50% actually of the Davos Main Street this year were dedicated to the kind of tech bros, I would say, so cryptocurrency and the blockchain bros. So everybody like basically took over the consulting guys. So that was a 50% of the main street of Davos, very expensive houses. And but with the same, what we brought and our alliance brought and Schwab Foundation, we brought first time 50 social entrepreneurs to Davos, and never been like absolutely from so many places in the world. This is first time when that's happened. And this is how the Davos is changing. We do, like the Davos man face is definitely changing. And that's the first thing. And we're definitely looking at the partnership. And the second thing, again, what I picked up, that's representation or diversity of thoughts in the decision, and that's what we need. And that's what, again, the Global Alliance for Social Entrepreneurship is also quite unique animal for the World Economic Forum as well, is because we are bringing these diverse thoughts. And that's because we're encompassing the organizations that are not usually the partners also of the World Economic Forum. Of course, we bring a lot of our private sector partners, and that includes Bayer, who is our strategic partner, but we also actually bring in Bayer Foundation together with us, with Bayer. The public sector as well. We bring in a lot of international organizations, but we also bring organizations kind of that we call enabling or intermediate organizations, so kind of other networks, like Impact Hub, like Agora or Ashoka, the ones who actually work a lot on the ground with the social entrepreneurs. We bring a lot of academic actors, like Oxford's call, like Katusha from Bertha Center. So actually, like diversify the thoughts from academic perspective, but also media organizations like DevEx, NBC, so to give the spotlight for the social innovation and bring their conversations of top on the agenda. My last point, but not least, is like, again, also what we've heard earlier today is to make the partnership business and public sector minded, both business and public sector, because we can see, even if we think that we can drive it only through the business, that's we actually see that collaboration with government works. Like, you know, and you actually can reach the scale. And this is why we see our strengths as well. But that's because of being the World Economic Forum and bringing, on the one hand, the CEOs of the companies at the table, and at the other hand, the head of governments at the table. And like the anecdote from Davos, I would say, that's appear here, and again, for Bayer, especially people, we had a Rodrigo Santos for our dinner with social entrepreneurs that was sitting with the social entrepreneurs from Brazil, and he was so inspired, and he said, this is my Davos moment. This is the best I can see. I'm so proud my organization is working to support that. So that's what we want to do, is bring in actually business leaders and likes of CEO to this conversation, that Rodrigo also connect to Monica after that and ask, how can we do it better?
Thank you, Katja. Yes, that sounds very important. Very, yeah. And I'd like to mention that two of the other panelists are actually members of the alliance, of Katja's alliance, and one is not. Maybe we can change that by the end of this panel. But Tapiwa, maybe you could tell us about Impact Hub. And you're working, you're based in Zimbabwe, but Impact Hub across Africa, and how being part of the alliance has helped Impact Hub.
Sure. Yeah, so Impact Hub itself is a global network of social innovation spaces. We're in about 60 plus countries across the globe. There's about 100 spaces that we're operating from at the moment. And I'd say the bulk of those are based in Europe, but we're growing very fast in Africa as well. And I think, yeah, one of the pieces that we've been most focused on is how do we sort of contribute in some sort of way to economic recovery, because as Katja said, we also believe that social entrepreneurs have sort of a big role in this, especially post-COVID. And a part of that story is really an alliance that we've had for the most part in this story with GIZ, so the German Development Corporation. Within Africa, we've actually delivered two really big response initiatives. The first one being the New Economy Booster, which was sort of right at the beginning of the pandemic, and we were thinking, yeah, how do we combat this thing, even though we have no real sense of where we are? So actually, the initiation of that program was really just to find out sort of which industries had been most affected by the pandemic. One of those was, of course, health, but we're also thinking of things like tourism, manufacturing, etc. And following that sort of identification of all of those different industries that had been most affected, we then ran an acceleration program for social entrepreneurs who were in those industries. So that was sort of the first initiative that we were involved in there.
During the pandemic, to sort of help them maintain their business.
Exactly, to help them maintain their business, but also to be a big part of the story of the recovery.
Sure.
So the countries that we were focused on at that time was Ghana and Nigeria. And then following that, we were thinking, how do we get, a little bit more involved in terms of, the narrative around economic recovery. And fortunately, that's when the alliance, the WEF Alliance, was coming up. So we were able to, hop on that train with Katja and the rest of the team, basically to, think about how we could deepen the impact, basically, be involved in an alliance of partners who were thinking the same as we were thinking, but also more broadly in terms of the geography, I would say.
Yes, it's a new alliance, but how are you thinking of using your membership as part of the WEF Alliance?
Yeah, so one of the great things about Impact Hub is sort of these spaces that I had mentioned. So now that we are, in 60 plus countries, I think one of the ways that we can add to the alliance in a way is when initiatives, come up, for example, the research that we're doing at the moment, basically, we have the access to all of the local actors in these 60 plus countries. So we can have those local voices, making sure that the solutions that we come up with are kind of relevant to, all of the different places that we want to have an impact.
Incredible, yes. And Katusha, the Bertha Center is also part of the Alliance. And I'm curious, you're more involved in the academic side, the University of Cape Town. And I'm curious how you've supported maybe the other social innovators. Maybe you can tell us a little bit about that.
Yeah, so I work for the Bertha Center for Social Innovation and Entrepreneurship, and we're a specialized unit of the Graduate School of Business at the University of Cape Town. And so I represent what was brought up earlier, which is the knowledge research development part of the work that we're doing. And specifically for the Alliance, we are very fortunate to be able to be doing a research project with them where we're developing a report on actionable insights that occurred for health entrepreneurs and social innovators during the COVID crisis. So if you think about COVID as a catalytic event or a systemic shock, what can that teach us about the health system and the social system, really, and how it responds to these kinds of events? And part of what we enjoy about being part of the Alliance is not only the opportunity to create collaboration, but it also gives us a chance to bring in other alliances that we're a part of. The Bertha Center is actually the parent of an organization called the Social Innovation and Health Initiative, which was founded in partnership with the London School of Tropical Medicine and Hygiene, the Skull Center at Oxford, and then also TDR, which is a special unit of the World Health Organization. And it's a network of global South academic institutions who are advancing a common goal of social innovation and health. So it's a great opportunity for us to collaborate on research and knowledge development, which this is project is a part of, but also to continue learning together, and not only through funding opportunities, but also putting out policy frameworks and things of that nature. And it's a really great example of South-South collaboration. In Africa, we have academic hubs at Makerere University. We have hubs at the University of Rwanda, University of Malawi. We have hubs in Nigeria and Ghana, and also hubs in the Philippines, South America, India, Vietnam. So how can we not only learn together in African contexts, but also how can we learn together as the global South? So this project that we're working on, I think, has so many wonderful applications.
That's a very important point, because often these alliances link up through centers in the global north, such as in Berlin, but it's important to create connections between South-South organizations as well. I'm curious, are there any examples of your research and your findings about how innovators can scale up, especially given their experience during the pandemic, be more resilient?
Yeah, well, yes. So we're at the beginning of this stage. So right now, we have identified a number of African countries that sort of span from nascent enabling environments for social entrepreneurs and innovators to mature enabling environments, and within that you have countries like Rwanda, Kenya, South Africa, Ethiopia, Somalia, Ghana. So the first phase was not only identifying those, but having interviews with about 80 plus identified stakeholders and partners to help get us to that answer to the question you just asked. What are the big barriers? What are the obstacles? And I think some of those you will know, which are financial, infrastructure, government, digital. And then we're also working with a consultancy called Impact Intelligence that brings in a machine learning aspect as well. And they're doing all of that deep data mining around social media, news, academic journals to fill in the gaps for us. So we're hoping that through this, we'll be developing some actionable insights that we can then go back and test, and hoping that we can publish by the end of the year.
Excellent.
Yeah.
Yes.
So stay tuned. Yeah.
Abimbolo, last but not least, I'm curious what your thoughts are listening to the others speak about their alliances and their collaborations. Whether My Medicine, which provides access to medications in rural areas, you were telling me whether My Medicine could benefit. You were telling me that you have a platform where users are actually quite happy, quite pleased, but you're looking to scale, you're looking for visibility and connections. So I'm curious what you make of this discussion.
So we've always known that you need scale for businesses like this to thrive. Social innovation is very keen on altruistic goals and very poor in seeking, financial gains. But it's really the reality that for sustainability, you must make healthy margins. So first of all, we started with aggregating almost 1,000 pharmacies because we needed to remain asset light and still have spread. And joining an association or alliance for us is always a good thing. Then it gives us more visibility to access resources, to access information or insights and opportunities, and then also to see areas to delve into that are not too far away from what we do. So I certainly want to be a part of that. I come from a country where
Nigeria.
Yes, in Nigeria. I'm saying it as a typical country where you need an environment that enables business. And it isn't always available. But you want to create it yourself. You want to create an ecosystem yourself. And in the ecosystem that I have helped to create, we've got medical doctors, physiotherapists, nurses, all of us trying to do things, innovate, and some form of formalization of that collective would be beautiful. We haven't quite formalized it, but would love to. So I think this.
Can you tell us a little bit about My Medicine's model? Like, what is the business case for My Medicine's sort of work?
So in seeing a dearth of access, we realize that you might be in Lagos or Abuja or Port Harcourt, and there are so many pharmacies around you. So it's normal for you to walk into one and get what you need.
Right.
But increasingly you find people with a prescription for maybe 6 or 7 things, and you can only fill 2. And you go from pharmacy to pharmacy to pharmacy. One, you end up thinking that it doesn't exist around you, or you have to then contact someone outside of you, maybe in another country, to help you send it down. That's just too cumbersome. Health is really acute. Most times you need the medication within a day.
Yes.
And so what we did was to aggregate the supply side and then create an avenue for you to order and would bring it to you anywhere. That has bridged the gap of accessing medication for issues, chronic illnesses and accidents. We've saved so many lives being able to provide you just the medication on time or even the medical devices that you need, and that's really solving issues. Then when COVID came, it was almost as though we predicted it and welcomed it, but we had planned for a time when you can't get out to get medicines, and the demand just went up like 10 times.
And I'm guessing, to that point, I'm guessing this is a problem across the continent. It's not just in Nigeria. So I'm curious, are your plans to expand across rural areas
Absolutely.
in Nigeria, but Pan-Africa as well?
We want to expand across Africa. We have covered Nigeria. We've delivered medication in 33 of the 36 states.
Okay.
For us, it's important to expand across because the same situation exists elsewhere. In Nigeria, we've got almost 200 million people being served by less than 5,000 pharmacies. Oh. And the 5,000 pharmacies are located in maybe 25% of the landmass.
Yes.
So you need more spread. You need more efficient logistics and simple technology to demand and then have fulfillment done. But you also need a clear line of sight across the inventory because each pharmacy is small and operating in silos.
Right.
And you want to then aggregate their inventory and then be able to use that as a powerful tool to serve.
So a single prescription might receive medications from different pharmacies.
Right.
So
but you want the user's experience to be simple so that he doesn't go out and maybe use something else that is bad or just ignores his medication anyway, and just, gets worse.
Yep. Well, thank you. I'm curious if the audience has any questions for our panelists.
Maybe I can add a little bit as well, like on your example, an example of my medicine as well. Not exactly, but like what Alliance, for example, can do for the social entrepreneurs. Like your own experience of the COVID, for example, last year, what we did like a campaign. We ran a visibility campaign for 50 last mile responders, how we called it in India. So we recognized 50 social enterprises. That's a lot of them just pivoted to address like drastic second wave of COVID in India when absolutely all the medical and public system were failing. They were working on speeding up the AR. They were working on what we talked earlier as well, on hesitancy about the vaccine and education about the vaccine, but also on the questions of increased actually domestic violence during the lockdowns and during the COVID, and in recruitment of the medical workers. So I can go on and on and on. So we recognize like 50 absolutely amazing enterprises, and then we connected them with the actors, specifically like in India, with the private sector and public sector actors, so they can help them to scale their operations. So for example, it was done through Dutch programs with Unilever and their Transform Hub. That's right now through the Alliance as well. We bring together a new partner such as SAP, and now their Transform Hub is a digital platform for social enterprises. So we connect these enterprises to the private sector, but also for the public sector. So what we did again, specifically in the States and India, we started the policy conversations that could ease the access, for example, for finance for specific social enterprises, or can scale their operations in the different regions, especially, for example, we will look at the migrant workers that also were specifically really affected by the COVID. So how we can take this example, so what we're doing, how we can, from the policy perspective, take these examples and scale it to other countries in the region. So that's how, just to put it, how Alliance works. So we are plugging in the enterprises like yours in the system so you can scale.
That would be lovely.
Sounds like we have a match. Yeah, great. Sika.
I had a question for Katusha. You mentioned that you guys are evaluating other countries' enabling environments for social economy. What were some of the criteria in establishing whether a country has that enabling environment?
Yeah, so we looked at the role of the public sector, the role of the private sector, availability of internal and external funding, and then also, I suppose it's a little bit of an intangible, but sort of try to measure the temperature or for innovation, I suppose, by the existence of accelerators or hubs of that nature. Yeah. So those were some of the criteria.
I think impact intelligence also kind of add
Yes.
in on that through scanning the policies as well. So what they do and what Katusha was saying, they kind of mining the data, but also basically to scanning the policies that's were recently implemented by governments or not implemented, or basically legislations that, for example, went to the assemblies but were not taken over. So that's how, through the kind of more data approach, you also can evaluate what is the environment in the country.
And Tapi, will you also use data to help your technological entrepreneurs?
Yeah, of course. As much as we can, we try to basically investigate, the local environments to understand what's going on and how best we could serve the local entrepreneurs. And from what you're mentioning, especially with this research that we're doing with impact intelligence and trying to understand which countries we can intervene in, I think some of the insights that they've been sharing so far from the data that they're pulling up is basically like measuring how much chatter is happening through the news and on social media on various topics. And some of the ones that I had picked up in terms of the themes are things like initiatives and programs to support health ecosystems, innovative solutions by startups and health. So these are just sort of like themes of what people are talking about throughout the region. And impact intelligence is able to sort of measure how prevalent each of these themes are within each country. And I think that's really important insight for us to have, because once we do get to the position of actioning these actionable insights, we're going to be able to basically target the countries that are talking about it most, and be able to sort of leverage on that energy and the chatter that's already happening.
Right, so there's
in those ecosystems.
Demand and people will
Exactly.
take to your programs more quickly.
Exactly.
Yeah.
Exactly.
Any other questions? We have a couple of minutes left. Otherwise, I had a question, sort of, I'm curious, we've been talking about post-pandemic a lot, and one of the priorities post-pandemic is to build a health ecosystem. So I'm curious if your work is sort of heading in that direction. Obviously, my medicine.
Yeah.
Yes. Perhaps you want.
So my work is definitely deep in that, but we see an opportunity to do much more. You see, many of the initiatives to gather data and to bring in health innovation ends up where there's no integration, and they're standalone, and you hardly use it for much more. So when you gather the information, what do you do with it? How does it inform the traditional birth attendant to change his behavior or his practices? We need to integrate further, and that comes from collaboration. I think building ecosystems that are safe for the medical doctor to collaborate with the pharmacist and not antagonize, which seems to be the norm, is really important. And then they can see a bigger pie and not struggle for a small one. And even when it begins to then inform investment coming into the sector, when you look at investment in fintech compared to health tech, it's almost 8-9 times much more.
Right.
But when they see an organized sector, an organized organizations working together, then more money can come in. There's better governance. There's so many things that can ride on a healthy ecosystem.
Absolutely.
I'm very keen for that to emerge.
Right, collaboration increases the size of the pie, so then everyone benefits in the ecosystem. Yeah.
No, absolutely.
Oh, yes. Well, sorry. Yes. Yeah.
No, I just wanted also to kind of, I was looking at Katusha as well and the systems. I mean, I think systems is a keyword on everything that we're doing. And Bertha Center was actually one of the co-authors of recent book also on the system works. I was not going to promote it, but it was written by our also Schwab Foundation director, who used to be a director also and a founder of the Bertha Center for Social Innovation. So it does speaks exactly of how we can use the community power to build innovation, but specifically at the system. So this is all about the system approach, but also for us, how we implement that as well is also a lot of changing the power dynamic and building a really level playing field in the conversations with the social enterprises. There are a lot of, like, again, a conversation with social enterprises just asking for support, whether it's from government or public sector or corporate. So this is a table where it is not an equal power dynamic. What we want to build is really a level playing field where actually the social innovator is the one who brings in innovation in the public sector systems that are failing, in private sector companies that needs to stay relevant, that needs to be ahead of competitors, and this needs to foster innovation. So we want to build a system approach as well through the bringing at the same table, but at the same level in the chairs, both social enterprises and the leaders, global leaders, and the global actors who are making the decisions.
Yeah.
It's an important point. Social innovators as catalysts for change in public and private sectors.
Yeah.
Stefan, you had a question? We have a couple of minutes here.
What you're talking about is also a conversation at eye level, right? Between relevant system actors who might be perceived as more powerful and integrators like Abby, for example, who actually make it happen, because that's always the one question that I'm asking myself, also coming from a meta organization. Okay, we're always talking about these things and we're bragging about the results of others, basically, right? We're not. And sometimes it's a little contentious, our attitude towards the people on the ground actually making a difference. So the question I have is more on this meta level, right? How do you, okay, you can maybe measure outputs because you have additional members of your network. Maybe you can, over time, address outcome on a level, policy level, for example, if you're on the university level. But how about the impact level? Because that's what impact is this buzzword that everybody uses, and nobody has any idea what it actually is. You know, how to describe the animal or the elephant in the room. That's ultimately, that is what we want, right? You want to shift, you want to change the game, you want to make it different. All this, in the beginning, Obi also made a point of saying, how you enter the conversation, these types of partnerships are the ones that change the needle. So yeah, move the needle on the global scale. So when is it going to be done? Or how do we know that we're going in the right direction?
That's
Anyone who wants to
great
take
question.
I mean, that's a question.
I think it's happening already. It is happening, and on a qualitative and quantitative angle, you can describe impact. Qualitative is the stories that those who are users of our services actually can tell. You find a grandmother in a suburb in Shagamu, and you can show her, she can show you how she's now able to access her medication just like anyone in the city. That's impact already. So we're saying there's no reason for you to leave your town or your village to move to the city to access good health. But then on a quantitative level, you can then begin to see the numbers that we're doing. That this transaction that is one singular is now in 10,000, is replicated 50,000, and everybody's looking for the 1 million. But for us, each one is a story of impact. And then when we can do more, I think that's really showing impact.
Yeah.
That you would answer, as I was criticizing.
Yeah.
Yeah, exactly. But I will answer, behind. But yeah, no, absolutely. I mean, that's a huge question, and for us, and I think we're all still, either big alliances, we're still thinking about it, or as a World Economic Forum are hosting several kind of directly impactful platforms that we want to be impactful. So we do think how to measure impact on the ground, because it is done through the actors like Abby. But as an example for you, what I'm trying to put, very small one. Again, we're very humble. We're starting. So, but as an example, I can put for you so last year we also launched a report with our other partner, who is like a Yunus social business, and maybe a lot of you know about them as well. Work in Berlin a lot. Celebrated a 10 years anniversary just a couple weeks ago. So we put together with them the report on the importance of social procurement and the cases for the social procurement, which is again the Bayer and Bayer AG especially is very innovative and going a lot of corporates, but we want to bring it to the definitely a new level of commitment. It was like a very first step in the report. So what we did, of course, okay, that's a report. Again, you guys took cases of some social enterprises that works with corporates. So what we do now is basically we're trying to measuring what is at least been an impact of that report. So we're contacted, that report was like more than like 500 downloads. So we contacted the people who downloaded this report and who want to say how did it change either their corporate culture or how did it change the work in the intermediate organization or did it foster some connections. And again, like a lot of this, so some things we can measure, but a lot of magic, I would say, is coming just from matchmaking. And like today, you already like at that table, you made a matchmaking between me and myself and Abi, yes? Like, and for us, it's as well. So it is a matchmaking. We are making matches between Impact Hub and Bertha Center because Unilever and SAP between the social innovators and the wider ecosystem. So it is happening also on the chemistry and magical level. So it is hard to measure, but I'm sure we will come with a digital solution to do that as well. So let's.
Well,
I could,
yeah,
sorry,
sure.
just to add to that. It's such a difficult question to answer, and there's the systems thinker Alice Evans talks about if you envision a tree, everybody's really embedded in the roots of the mission and the vision, and everybody really understands how the leaves and the berries of the outcomes and that happens. But where we don't spend time is on the trunk, on the scaffolding of getting from the roots to the fruit. And that's oftentimes very unsexy, right? It's the time and the relationships and the meetings and the emails and developing the momentum to get going. And part of that is also funding, right? Because you don't get funded for that kind of work. You get funded for your outcomes. So it's a very multi-layered conversation. And I think that's what makes it so exciting. I mean, I'm sitting in academia. Of course, I like that kind of nebulous opportunity. But it's great to have the opportunity to connect with folks like Abby to see what it is actually like on the ground and then see what it goes like up into the meta, yeah.
Bottom line, if you want to have coffee and matchmaking, go to me and then for the data to Katusha.
Well, I hope everybody's inspired by some of the collaborations that we've been talking about on this panel, and maybe it'll inspire you in your own conversations with these entrepreneurs and others for things that you might start conversations about or link up with other people about. I believe so maybe we can have a round of applause for everyone. Yes. Yeah.